My name is Daniela Verde Soto. I am a student, Universidad Católica Santiago de Guayaquil. Title, Lyme Disease, definition. It is a bacterial infection that is spread through the fifth of the one or several types of ticks. There are four main species of bacteria that cause Lyme disease. Borrelia burgdorferi and Borrelia majoni cause the Lyme disease in the United States, while Borrelia aferi and Borrelia garini are the Lyme caused in Europe and Asia. Diseases affect the skin nervous system, hair, hands, and muscles. The affectation varies according to the causative Borrelia species.
Is an infection due to spirochete bacteria of the species Borrelia burgdorferi, which is native to North America, or Borrelia journei or Borrelia afzelii, which are native to Europe and Asia. So the Borrelia bacteria is transmitted by the zombie tick pictured here, and the tick itself will actually be infected with the Borrelia bacteria after biting a small rodent. So the small rodents, such as mice or rats, actually act as the primary reservoir for Borrelia bacteria. White-tailed deer act as the host for ticks. So the cycle of transmission is as follows. The tick, an uninfected tick will bite an infected small rodent, will carry the Borrelia bacteria, will either transmit the Borrelia bacteria to another small rodent, it can transmit it to a human through biting, and generally will attach itself to the host, white-tailed deer, and will lay eggs, and this cycle will continue. After tick attachment, an infection of Lyme disease generally occurs at least 36 hours after tick attachment or after the tick has bitten onto a patient. So the clinical presentation of Lyme disease changes as time progresses in the disease. There are three different stages of Lyme disease. Stage 1 is considered an early localized stage of infection. It usually occurs 7 to 14 days after a bite. The patient experiences malaise, fatigue, headache, and myalgias. And there's a characteristic skin lesion known as erythema migrans. This is called the bull's eye target. It's non-pruritic and it expands. So the outer ring will continue to expand out, and there will be a red center, but it is a non-pruritic skin lesion. Stage 2 is considered an early disseminated stage. It usually occurs within weeks after a tick bite. There are central nervous system symptoms such as neuritis, cranial nerve palsies, and meningitis. There's also cardiac symptoms. We see something known as Lyme carditis occur at this stage. This is where we see myocarditis and some AV blocks, could be first degree, second degree, or third degree block. In stage 3, this is considered a late persistent stage. This usually occurs months to years after a tick bite. The patient experiences chronic arthritis. It could be monoarticular or oligoarticular. There's also neurological symptoms involved. There's symptoms such as neuropathy, meningitis, and encephalopathy. And with regards to infections with Borrelia afzelii, we see another characteristic skin rash known as acrodermatitis chronica atrophicalis. it's a reddened skin rash in different parts of the body. An easy way to remember the clinical presentation for Lyme disease is the mnemonic, bake a key lime pie. So we've heard of key lime pies, many of us have eaten key lime pies. So you got to think of bake a key lime pie. The clinical presentation is in the word bake. B stands for Bell's palsy. There's also arthritis, we mentioned this before. There's also cardiac block. We use K for cardiac, even though it doesn't spell cardiac, but this is an easy way to remember it. So cardiac block can be first degree, second degree, or third degree block. And the E stands for erythema migrans. So those are the four keys for clinical presentation of Lyme disease to help us remember what the clinical presentation of Lyme disease is. Bell's palsy, arthritis, cardiac block, erythema migrans. So how do we diagnose and treat Lyme disease? The diagnosis can be concluded through the clinical presentation, such as seeing a characteristic lymphocyte target lesion, such as erythema migrans. Or we can do serology, looking for anti-Braille or door-free antibodies. We can use ELISAs or Western blot to detect these antibodies. For treatment depends on the stage of the illness. Stage 1, we use amoxicillin or doxycycline or cefuroxime. For stage 2 to 3, we want to use ceftriaxone. For prevention of Lyme disease, we want to take care to ensure that there are no tick bites. But if there are tick bites, we want to use an antibody prophylactic treatment. That is normally doxycycline. We usually use this within 72 hours of a tick bite. But with doxycycline, we always want to remember that it is contraindicated during pregnancy, lactating women, and for children under the age of 8 years old. So anyways, guys, I hope you found this lesson helpful. That was a quick lesson on Lyme disease. If you found this video helpful, please like and subscribe for more videos like this one. And as always, thank you so much for watching, and I'll see you next time.
Application in medicine. Seek your doctor advice if the signs or symptoms go away because the absence of symptoms does mean disease is gone. In the left underarm, Lyme disease can spread to other parts of the body several months to years of the infection, causing arthritis and nervous system problems. These can also carry other diseases such as varices or cholerative fever. The most common sign of the infection is an area of the expanded skin redness, known as erythema migrans, that appears at the season of the ticks by about a week after it's occurred. Pain find approximately 70-20 of infection people develop a skin rash.
What started as routine testing ended with the discovery of a new organism.
We had Lyme disease affecting humans, but caused by a different species of bacterium.
A bacterium dubbed Borrelia mayonii in honor of the founders of Mayo Clinic. A bacterium that appears to be localized to the upper Midwest. Like the other known cause of Lyme disease, it's believed this organism is transferred to humans through the bite of an infected tick. Patient symptoms, including fever, neck pain, and rash, appear to be similar but not identical to other cases.
Notably, they were more likely to have nausea and vomiting, and the rashes were more diffuse. So it wasn't the classic bullseye rash that you see with Lyme disease.
Traditional Lyme disease treatment methods have worked in cases caused by the newly discovered bacterium, and protection will sound familiar too. Stay out of tall grasses, wear long sleeve clothing, tuck your pants into your socks, and use an insect repellent such as DEET to avoid your own discovery of Borrelia mayonii. For the
Pros and cons. Pros. Most causes of the Lyme disease can be cured with an oral antibiotic regimen for 2 to 4 weeks. There are few stories of the Lyme disease. Story 1. Color early and localization Lyme disease. The bacteria have not yet spread throughout the body. Story 2. Color early spreading Lyme disease. The bacteria have started to spread throughout the body. Story 3. Color late the later spreading Lyme disease. The bacteria have spread throughout the body. Cons. The bacterium is spread by the blood and lymphatic routes and relates to SWAT 2, with clinical manifestation involving the hair, nervous system, joints, and skin. The cardiac manifestations are developed from 4% to 10% of the infection. Individuals and April, which 5 weeks. Issue application in Ecuador. The treatment consists of the application of antibiotics, which vary according to the start of the disease and the age of the patient. Ibuprofen is also given to relative inflammation. Early indication in the early localization that allows the complete resolution of the vast majority of the cause. The treatment of the early infection 32 local or disseminated consists of the lower doses of the oral antibiotic with doxycycline orally 12 hours or 14 days is the treatment of the current item in the could also be used amoxicillin. For 14, 21 days is the child or pregnant the woman.
You can protect your dog in the United States against Lyme disease, but you can't protect you and your children with a vaccine.
Dr. Gregory Poland, director of the Mayo Clinic Vaccine Research Group, says there was a vaccine for humans, but it was withdrawn.
The primary reason is there was immense anti-vaccine sentiment about the vaccine, much like we had with measles vaccine. It's illogical.
It's the bite of an infected black-legged tick or deer tick that's responsible for making so many people sick with Lyme disease.
There are probably about 300,000 new cases a year.
There are no plans at this time for a new Lyme vaccine in the US, but there is good news. A vaccine, VLA15, is being developed in Europe.
They've been through phase 2 testing. Now they'll do phase 3 clinical testing, which means they go to the FDA, get approval, and they'll do very large studies.
Dr. Poland says it might take 5 years or more before we see a Lyme disease vaccine ready for humans. Until then, it's important to be tick smart. For the Mayo Clinic News Network, I'm Ian Roth.
Conclusion. Lyme disease can cause a weak infection in this. It is not rather in the time according to the story it is. In Ecuador, to date, only one case of the Lyme has been reported. Thank you.